Dr. Suganthi Iyer, our upcoming speaker, is a prominent figure in the field of healthcare. Her specialization in both legal and medical aspects of healthcare makes her a unique and invaluable contributor to our conclave. Her dual expertise allows us to explore critical intersections between these fields, shedding light on how they impact patient safety and healthcare quality. Let's know more about her.
Can I start?
Dr. Suganthi Iyer, Medical Legal Consultant and Hospital Administrator. Dr. Suganthi Iyer is from Seth GS Medical College and KIMS Hospital, Mumbai. She is qualified in Hospital Administration as well as Law from New Law College, Mumbai. She is now currently with Hinduja Hospital, Mumbai as Director. Besides, she was a visiting faculty in Law at University of Mumbai, TISS and at other various institutes. She is a NABH Principal Assessor, Faculty for NABH Workshops and is member of NABH Appeals Committee. Dr. Suganthi Iyer has participated in a large number of workshops on legal aspects and contributed to publications and chapters in books pertaining to legal aspects of healthcare. Her area of forte is legal, medical legal and hospital administration. She has been convener of Medical Legal Cell of Indian Medical Association, Mumbai branch for several years. A warm welcome to Dr. Suganthi Iyer, ma'am.
And various court judgments which emphasize that the patient's safety is very important and the responsibility of the hospital. The hospital and the doctors are ultimately responsible for the safety. They have to take care of the safety, ensure the safety. And if there is lack of safety in any manner, the punishment definitely goes to the hospital as well as to the other members like the doctors, nurses and other staff. So by various judgments, we will now see how safety is important, not just as an NABH or a quality phenomenon for the patient, but also in the courts of law. In the case of E-Medical Center versus Jayashree, in this, a patient called Purushothaman, who was a cardiac patient, was admitted in the center. After a few days, he had to go on dialysis, and then finally, he had to go to heaven. On the same day in the evening, there was another patient called Kanthi who suffered from ESRD and was on regular dialysis. He also expired on the same day and body was also kept in the mortuary side by side. Later on the next day, the relatives of Kanthi approached for the release of the body. The body of Purushothaman was shown by the mortuary keeper to the relatives of Kanthi, mistaking it that of Kanthi. The relatives of Kanthi saw it from a distance and they thought it is that of Kanthi and they took the body and they went away. They finished the rituals, the burning, everything. Later on, the relatives of Purushothaman come on the scene to the hospital and demand for the body. When the body of leftover Kanthi was given, they immediately said, this is not that of Purushothaman, this is somebody else. Both from a distance had long faces and were bearded. On close examination, the mortuary keeper discovered his fault, that he had given the Purushothaman body to the Kanthi relatives and left with the Kanthi body. Purushothaman relatives refused to accept Kanthi's body naturally and they demanded and they made a lot of noise. Immediately, the relatives of Kanthi were contacted. They said they had already completed the burial, the burning, etc. They had the ashes left. They got the ashes back to the hospital. The ashes were given back to Purushothaman's relatives. Purushothaman relatives, they refused. They made a lot of noise. They said, how can the rituals be finished? We have definitely been wrong. We wanted the body. We had to complete the rituals. We had to do everything. We have suffering mentally because there is no cremation done by us in our own rights, in our own religion, etc., etc. With this, they went to though they accepted the ashes ultimately, and those with the ashes, they did whatever they want, and the body of Kanthi was ultimately given back to the relatives of Kanthi. Later on, the relatives of Purushothaman went to the court of law, to the National Commission at Delhi, and they said they have been wronged due to religion and other things. They have been wronged because emotionally and this socially, they have been deprived from performing the religious rites for their relative, which is their basic fundamental right. They have to have the right of doing the cremation, and this was not given to them, and therefore they sought for damages of 1 crore. And this was definitely during the COVID period when bodies were shown from a distance. Ultimately, the National Commission granted them 25 lakhs. Now, this is the legal point, therefore, is that when they had to be given their body, they were deprived, and for the burial and for the last rites of their body, they were deprived as per the constitution, the right to religion, the right to perform the rituals of the dead by themselves. And therefore, this is a legal point. The safety point says that the dead bodies should have been labeled. Yes, the dead bodies probably have been labeled. But what is lacking is the checking of the tags, checking of the dead bodies.
Sorry to interrupt, ma'am. The slide is not changing.
Yes, slide need not change. It's the same slide.
Okay, ma'am. Okay, thank you.
The first case is going on. First case is going on.
Okay, ma'am. Thank you.
Yes. So this is case number 1. So they were the safety point is that though the body was all labeled, the wrong body was handed over without checking by the mortuary keeper. So the safety point says that it is not enough if you label, but please check and counter check and confirm it is the same body before you hand over. This is an identification error, and for this identification error, the compensation was given. Case number 2. Case number 2, Rashmi Tandon versus NM Medical Center. In Rashmi Tandon versus NM Medical Center, patient Rashmi Tandon went to the hospital. She was a kidney transplant patient, age 32 years. She underwent the surgery of kidney transplant. This lasted 4 hours. During the long 4 hours, the blowers and the heaters were on. Since the blowers and heaters were on because of the cold temperature in the operation theatre. Later on, they switched off the blowers, heaters and other warm things. However, because of malfunctioning of the heaters and the blowers, that was still going on. The heating was going on, and 4 fingers of the right hand got extremely heated and they got burnt. At the end of the surgery, they realized that 4 fingers have been burnt. Later on, when she was shifted to the ward, they become gangrenous. They took for the surgery, amputation of the 4 fingers were done. The artificial fingers were fitted. However, they did not function well. And therefore, ultimately, she was discharged from the hospital, and the patient went to the court of law that she had come for a kidney transplant, which went up surgically well, but ultimately she was deprived and she lost 4 fingers. So in the court of law, where she went to the National Commission, they said, yes, what has happened is what is known as res ipsa loquitur. Things speak for themselves. She's come for a kidney transplant surgery. She goes for it with a successful outcome, but with minus 4 fingers, and a compensation of 10 lakhs was granted. As for the safety component, one has to say that all the equipments have been functioning properly, that everything, the preventive maintenance, the preventive maintenance and all the other maintenance have to be done properly. Things are functioning properly. In this case, as far as the biomedical checkup was concerned, the checking up of the equipments was not done, and this is the safety component. The facility factor has failed, and this is a safety factor in this judgment. In the third case, Y Hospital, Yashoda Hospital versus UD, in this the patient goes for an ERCP. Now for the ERCP, anesthesia is given, and as an anesthetic, the propofol is injected. After the propofol injected, then what happens is that after some time, the patient goes into a cardiorespiratory arrest. For resuscitation is attempted, but unfortunately it is not successful, and the patient suffers a hypoxic brain damage. After the hypoxic brain damage, the patient is then discharged and transferred to another nursing home, where the patient survives for 2.5 years and then dies. So therefore, the legal point in this, the relatives went to the National Commission saying that they had come for a mere procedure of ERCP, but landed with an hypoxic brain damage, and they had taken a vegetable home whom they have to take care for a long time, and this is causing a lot of damages to them, a lot of mental torture and a lot of physical torture, taking care of medical care, keeping the ward boy, ayah, medical checkup, etc. The National Commission agreed that they had come for a small procedure. This is, therefore, they also went to the documents. There was absolutely no documentation. In this, the anesthetist, after injecting the propofol, should have taken care of the monitoring of the patient. They would monitor the pulse, the blood pressure, the saturation, and other factors of the patient. In this, the monitoring of the patient of the anesthetist was lacking. The lack of notes was there. There was absolutely no notes during the ERCP of the anesthesia monitoring. This showed clearly that the anesthetist was not conducting the monitoring phenomenon for the patient during the procedure of anesthesia. Also, later on, probably the intubation could not be done because there was no muscle relaxant given, and therefore it suffered. The patient had hypoxic brain damage, and because of lack of monitoring, lack of documentation, and anesthetist deficiency in duty to take care of the patient lacking, they gave a compensation of 47 lakhs. The safety factor here is that propofol is definitely an anesthetic. However, when we say anesthesiologists, they are like the pilots in the plane who fly the plane. They go into the inactive mode. They just rest behind. At the same time, they have to be very vigilant. When something goes wrong, they have to jump into action and take the corrective remedy. In this case, similarly, the anesthesiologist, after injecting the anesthetic, should be vigilant, and they should continuously maintain the pulse, BP, SpO2 and other factors. And the minute they cannot record or something goes wrong, they have to come into action, give the muscle relaxant, intubation, everything. Here it was all lacking, and therefore the safety factor is that the monitoring of the patient was not done by the anesthesiologist, and therefore the patient landed into such a condition. In the next judgment of National Commission, Dr. Kakkar versus Neetu Singh. The patient Neetu Singh had a 9 months amenorrhea. She had come for the delivery. On the OT table, she had a pre-eclamptic fit. During the pre-eclamptic fit, the anesthesiologist gave the sodium pentothal and also the scoline. The scoline helped in the muscle relaxant. The patient was intubated. After that, the LSCS was done. A good live baby was removed, and during that, the full monitoring was on: oxygen, SpO2, monitoring records were there, BP monitoring, etc. was there. But ultimately, the patient had the hypoxic brain damage. The MRI showed the damage. The patient was in a private nursing home after discharge for 11 years. The relative said that she had come for delivery, but there is hypoxic brain damage. You have to take the patient home. In the court, everything was examined. The documentation of the anesthesiologist was complete: pulse, BP, SpO2, etc. The anesthesiologist had done the needful during the LSCS. However, we have to remember there was a pre-eclamptic fit. During pre-eclamptic fit, it is like an electric shock. It is like an electric current, during which there could be ischemic damage to the brain. And this is what the expert control panel commission said. During this, the pre-eclamptic fit, there has been irreversible damage to the brain because of hypoxia, and that is the reason for the condition of the patient, of the vegetable condition. It is not the mistake of anesthesiologists where documentation and also the monitoring has been complete, and therefore the case was dismissed. So effective monitoring and documentation saved the hospital and the doctor. So safety point lies that when the anesthesiologist renders the anesthesia, constant monitoring has to be done, the notes have to be done. And this is not only in the case of anesthetist, but also in the case of intensivist. Intensivist also has to constantly do the monitoring in the ICU. In the next case in National Commission, Sanjay Mota versus Jayashree Desai. Here the patient, the wife of Mr. Desai, Jayashree Desai, was taken for a procedure for fallopian tube testing. They had gone for the secondary sterility testing. They wanted a second baby, and for testing the fallopian tube, again the anesthesia was given. However, the anesthesia did not last the full duration of the procedure. The patient felt pain. There was again a convulsion, and then there was an arrest, and again there was a hypoxic brain damage. So this is similar to the earlier case where the anesthesiologist gave anesthesia for a very brief time, and that too without a muscle relaxant, and therefore during the CRRS they could not successfully intubate, and therefore the patient had a hypoxic brain damage. Similarly, the relative went to the court that they had brought for a FT, small procedure, but the patient landed brain dead, and therefore in the court again it was realized that there was no documentation by the anesthesiologist during the entire case. That means the anesthesiologist, after giving the brief anesthesia, has not monitored the patient, and therefore due to deficiency of service, lack of care, lack of monitoring by anesthesiologists, this is the legal point. The compensation of 38 lakhs was given, and the safety factor lies that the monitoring has not been done by the anesthesiologist after administering anesthesia. Anesthesia may be for a brief period of 5 to 10 minutes. However brief it is, anesthesiologist has to be in the vigilant mode. Monitoring has to be done. There has to be the constant notes, which is the evidence of monitoring. In the next case, Mazumdar versus Batra, case number 6. In this, Mazumdar was admitted to the Batra hospital. The patient was suffering from dengue. The patient has a high temperature of 104-105 degrees temperature, and he was having the delirium. And because he was in a delirium, he wanted to have he got the call of the nature in the middle of the night. So in the middle of the night, when he had the call of the nature, he went near the window. He assumed it is a toilet door. He was entering the toilet, but it was a huge window of the floor. He walked out of the window because he was in a stage of delirium. And when he walked out of the window, he fell down on the porch below and he broke his limb and his head. And therefore, he had head injury and multiple injuries. Third came the noise in the middle of the night and everybody woke up. His sister who was sleeping by the side woke up and was astonished to find Mr. Mazumdar on the pedestal below with head broken and limbs broken. The hospital people immediately rushed, brought him up. They operated on him, everything. But then what happened is that the patient had multiple fractures and head injury when he came just for the treatment of dengue. And he had fallen out of the window, assuming it is a toilet door, which he assumed because he was in delirium. So he went to the court, the relatives went to the court that this is what happened and and we want the damages. We went for dengue and we have landed with multiple injuries and this is causing physical damage, mental damage, and we have to spend a lot of money, pecuniary damages, special damage, other damage. There are so many damages when it comes to a court of law. The National Commission ruled that, and this is a Supreme Court judgment, mind you, this is a Supreme Court judgment. The Supreme Court judgment said it is a duty of the hospital to ensure the safety of the patient. When they admit the patient in the hospital, that the patient is in safe custody. All the factors for safety, whether it's facility, whether it is monitoring, whether it is equipment, biomedical equipment, whether it is infection control, whether it is medication, entire safety lies the responsibility of the hospital. And here the hospital has lacked. Yes, the hospital said his sister was lying next to him, but the Supreme Court said his sister is his relative. From the side of the hospital, who was there to supervise the patient? You should have had somebody to supervise the patient because the patient is in a state of delirium due to high fever. So safety lies, the responsibility of safety with the hospital. They should have deputed a nurse or a ward boy or attendant to take care of the patient. If they had been deputed, such a damage would not have occurred, and therefore the safety of the hospital lies with the hospital. This is what the Supreme Court ruled. A huge compensation was granted in this case. In the 7th case, St. Gregory's Hospital versus Jesse, in this the patient was alcoholic and psychotic, and it was a de-addiction center. The patient came to the hospital and was admitted for the treatment. Now this patient at the afternoon 2 o'clock goes for the wash. He goes to the side of the bathroom and never returns. When the other patients wonder where he disappeared, and ultimately they find him hanging by the lungi, dead by hanging by the lungi in the foyer of the hospital. Suddenly his wife is summoned, the hospital authorities are summoned, etc., etc. And then naturally it is a big thing. The wife was very upset, family members were upset, the brother was upset. They came, they went to the court of the law. We had brought our brother for de-addiction and he's handed dead. He's committed suicide by hanging with the lungi in the foyer. The hospital has not taken proper care. They are not ensured the safety of the patient. And this was again a National Commission judgment. The legal point is that the National Commission clearly said the safety of the hospital in this case, in every case, is the duty of the hospital. Now what they said, in this case the patient is an alcoholic and also a psychotic. Now it is compared to a school. In a school, when they send out the school children, the teachers, the principal, other custodians, they have to ensure the safety of the children. But when the children are taken for a picnic, say for near a lake or a river or wherever it is, they have to take extra care that the children do not go into the water, slip into the water or drown. Same way a hospital has to ensure the safety of the patient, facility and otherwise. But when it is an alcoholic, psychotic and other such similar problems, they have to take extra precautions. Under the Mental Health Act, we have several provisions where we have extra attendance. We have the all these windows and the doors have to be all having the bars. They have to be under lock and key, and extra precautions like the railings, the locks, keys, chains, etc. are there under the Mental Health Act. So even psychotics must be admitted only when there is a recognized Mental Health Act. That is it, with all the extra requirements. So the hospital, when they admit such patients, should have extra care to be taken. This is what the National Commission ruled, and they granted a huge compensation. So the safety factor, we take care of all the patients who are normal. But when it comes to such patients, please, one has to ensure there is extra facilities, extra care, and extra points which are created to take care of such mental and psychotic patients. That is a message. In Lala versus HH Hospital, this is another Supreme Court judgment saying about safety. In this, a patient who was weighing 110 kilos, who underwent the spine surgery and paratheater surgery, comes for a follow-up to the hospital, and she comes to the compound of the hospital. The ward boy is missing. The security guard, who is the watchman, takes a wheelchair, pleasantly keeps her on the wheelchair, and then forgets to put the seat belt because he's a security guard. He doesn't know how to do the ward boy's job. He says, okay, I will take you up to the first floor for the follow-up. He takes him on the ramp, and in the ramp, it is the opposite direction because he doesn't know the function. Ultimately, this lady falls off the wheelchair. There is no belt. She's an obese thing. Over the ramp, it is wheeled in the opposite direction. She falls head over with in collision, head-on collision. She gets an ankle fracture. The lower bones and the ankle is fractured. She's hurried up to the orthopedic OPD, and then they put a plaster, and they even charge her for it. They don't even condone the fees after all these things. So therefore, the husband, this was a senior citizen, the husband also senior citizen, goes right up to lower court, up to Supreme Court. I want compensation. Yes, compensation is granted. I went for a follow-up, and this is what I landed with a broken ankle. She's senior citizen. 3.51 lakhs granted to the patient. Well and good. So this is a legal point that one has to ensure the patient is taken care, the safety, that is all the legal point. But in our NABH, so the quality point is that the seat belts are there, it has to be done properly, the wheelchair have to be wheeled properly. Same thing occurs in trolleys and other things where you have to see the security of the patient, they do not fall off, and other your nurse belts and other things, devices, you land all over the hospital. See that not only the correct people handle, see that the people are trained. Training is very important. Here the security guard was not even trained for the job. So that is it. So this is a safety message. In the next case, case number 9, Harjot Aliwalia versus Spring Meadows Hospital. A young man of 10 years old comes to a hospital with high fever, enteric fever. The child is prescribed by the pediatrician chloramphenicol, and the doctor is given for the first 3 days. The child is definitely better. However, on the 4th day, the chloramphenicol vial is finished. The nurse writes a prescription. The doctor is supposed to write. The junior doctor tells the nurse. The nurse gives the prescription, assumes it is chloroquine, gives it to the father. Father goes and purchases the chloroquine, and it has to be admitted. She again tells the junior doctor, please administer. You are supposed to administer the IV injection. Against the doctor tells the nurses, you people are better in the IV. You all are experts. Go ahead. So she loads the chloroquine and gives a bolus shot as if she like chloramphenicol, because the instructions are given bolus shot. Now all this happens. You can imagine a bolus shot of chloroquine into a young person, and then goes into cardiac arrest, and ultimately cardiac arrest. She runs for the oxygen cylinder. The first oxygen cylinder she tries to open, no oxygen, it is empty. Goes for the next oxygen cylinder, that also is empty. Hunting for the third oxygen cylinder. After 15 minutes, oxygen is given. By the time his brain is dead. So this 10-year-old boy coming for treatment for enteric fever ends up with a hypoxic brain damage. Now comes the parents into picture. What is happening? I brought for fever. The patient is better, and I go home with a vegetable. The boy is just 10 years. For the rest of the life, we have to suffer financial damage, physical damage, exemplary damage, then pecuniary damage. All types of damage is claimed. A huge compensation was granted in at that time. Now, the legal point is that there is deficiency of care, not only while administering the medication, but there is deficiency that an untrained nurse has given who is not qualified. It was supposed to be given by a qualified doctor, and also deficiency that the instruments and equipments not in order, oxygen cylinders are lying empty. So, this has gone up to Supreme Court. They have granted the compensation. Safety factor. Safety factor is that instead of giving chloramphenicol, you're supposed to check the dose, the nature of the drug, the mode of administration, etc. But the chloroquine is given in its own this thing. The checking of the drug is not given. Double checking of the drug is not done. Also, number 2, the facility checking, the fullness of the oxygen cylinders are not done the checking. All this, and also this is given by a untrained nurse. This is another safety factor. So therefore, this is the message with respect to the safety. Now next case, case number 10, Mission of Mercy versus Mazumdar and others, wherein the patient has to be given the blood transfusion, the patient has the refractory anemia and blood transfusion has to be given. The blood comes, the blood is checked, the grouping cross-matching is done, everything is perfect. However, in the blood, there was a hurry to transfuse the blood. The nurse wants to go off duty. So the blood is cold. We have to warm up. She gives the cold blood to the patient. Immediately the cold blood going at a fast rate because she wanted to finish off her work before she goes out of duty. And the next nurse may come, may not come. There was a big doubt. So she wanted to hurry up, the cold blood going all over the body, severe pain for the patient and trembling all over and restlessness, and the patient is complaining. The relative goes and tells the nurse and phones the doctor is at home and telling give the fortune and give the compost. Doesn't send the junior doctor to examine the patient what is happening. Fortune and compost given and the patient just goes to sleep. The patient eternally goes to sleep because of all these things, and then the patient is found dead. So naturally the relative is very upset. I bought for treatment of a condition and I take a dead body and with all this after the blood transfusion, and naturally the National Commission said this is a deficiency of service. The blood was not given after being warmed up. The nature, the due care, the diligence, the caution was not exercised by the hospital staff that it has to be given in the proper form. There was no monitoring for the adverse reaction. Nothing was being done. There's no recording of, when the blood transfusion is done, what is happening. Nothing is being done and therefore a compensation is given. Safety point, one has to check the blood after grouping cross-match, the nature of transfusion. You have to give slowly. You have to warm up the blood, the monitoring records, safety factor. Also, this is the lack. In the next case, case number 11, Pukran Ravichandra versus Master Rajput. In this, a polytrauma patient comes and the patient, multiple injuries, they advise the painkillers and the antibiotics. The antibiotic is given. However, the antibiotic in a hurry is, after the antibiotic is given on the right hand, later on the hand becomes little discolored, then it becomes black, and later on it becomes the gangrenous. The patient takes a discharge, unhappy with the hospital, goes to the next hospital, the hand is amputated, and then they file a case that we went there for the antibiotics for some fracture, and we end up with the loss of the hand. Now, when the National Commission at Delhi says this is a deficiency of service by the hospital that you go for treatment and you end up with the amputation of the right hand, and because the patient has lost his hand, compensation is granted. Now, from the safety point of view, what is discovered is that the antibiotic has to be given intravenous, but the antibiotic is given intra-arterial. Therefore, an intra-arterial in the extremities, that too in the distal extremities, vasospasm and other things happen, and the patient is not been examined, nothing has been done, patient lost his hand. So this is a safety factor one has to watch when you give the medication. Not only the dose and the name and all has to be checked, what is the drug, but also mode of administration. There are enough cases in National Commission and Supreme and even in lower courts where patient has lost their limb because of instead of giving intravenous, it has been accidentally given intra-arterial and nothing has been done about it. That is it. So this is very important from safety point. In PGMR versus Jaspal Singh, here the patient is a case of 50% burns and had to be given IV fluids and plasma and blood. Patient is A group. A group was given 2 bottles of blood for first 2 days, and later on for the next 2 days probably there was shortage. The hospital gave B plus positive. Now after the transfusion of B plus positive, there was a deterioration in the condition of the patient. Till that time, the patient was doing much better. The patient improved a lot. But once the patient was given the B plus blood for 2 days, it took a nosedive deep in the condition of the patient. The liver function got damaged. The kidney function got damaged. There was multi-organ failure, septicemia. Ultimately, patient died. Therefore, the relatives went to the National Supreme Court. This is a Supreme Court judgment which said that we went for a burns for the treatment. Patient was improving, and suddenly after all this, there was this thing and we lost the patient. Supreme Court said this is a mismatched blood transfusion. The wrong blood group has been given. No, and not only the first day, the second day, there was no monitoring. There is no monitoring for adverse reaction. It should have been stopped. Everything, when there's an adverse reaction, nothing was taken. And no doubt there was an error. Errors do happen, but you should notice the error, monitor the patient, and do your best to salvage and reduce the damage and save the patient, which was not attempted in this case. So compensation was granted. From legal point of view, that is a thing. From safety point of view, one should not give the wrong blood. One should not give the mismatched blood transfusion. You have to give the right blood. The grouping, checking, etc. You have to constantly monitor, give it in the proper rate. They have to be monitoring records. This is a safety point. Case number 13, Agarwal versus Sanjay Gandhi, PGA Medical Sciences, wherein the patient was a case of duodenal ulcer and a contrast CT study was ordered. Urografin was injected for the sake of contrast in a contrast study. It was injected in the left side. Now the patient, it was injected in the vein. The first ampule, the patient got slight pain. The second ampule, the patient got more pain. Third ampule, the patient did not even allow the doctor to finish, the nurse to finish giving the injection. Then she went to the right hand and then injected several ampules of dye for the contrast. And it pleasantly went. The CT contrast study was completed, etc. After a few days, the patient discovered the discoloration in the left hand. There was severe pain in the left hand. There was difficulty in movement. There was paresis, etc. And after, when they followed up, they found there was a contracture. And this is known as a Workman ischemic contracture, where there's paresis. And this is because the dye from the vein, there was a counterpuncture, had extravasated into the tissues. So when the dye goes into the tissues, it spreads. It goes to the nerves and other thing, carpal tunnel, etc. and affecting the nerves. The nerves also got damaged. And there was a Workman's ischemic contracture, damage to the median and the ulnar nerve. It is a permanent disability. Because of the permanent disability, the patient relative went to the National Commission and then asked for the compensation. And because of permanent disability, which is a legal point as per the compensation, Workmen's Compensation Act, etc., Disability Act, they got a good compensation. As to the safety aspect, when one injects a medication or a drug or whatever it is, in case a drug, you have to check not only the type, the duration, the constituents and nature, but also see to the mode of administration, how it is going. Is it going properly? It is not going in the vein, accumulating in the tissue. This monitoring has not been done, and no salvage for whatever damage has been done has been taken care. There is no proper examination. It is not properly administered in the root, and therefore this is a safety point. Case number 14. This is a very recent National Commission judgment in the month of May 2023. Parikshit Dalal versus Santosh Dalal. In this case, a 9 months full-term pregnant lady, age 32, lands in the operation theatre. This is a hospital in Karnataka. And then the anesthetist gives anesthesia, gives the muscle relaxant, intubation is done. About the obstetrician is not yet started the surgery, not yet put the incision. Immediately the patient goes into shock, and the anesthetist does her best, does her CPR, and ultimately they take the patient to the ICU. Patient dies after half an hour. Relatives come to know that the delivery has not occurred. The patient, something happened, and they were told it's anaphylaxis shocks. The patient has bled inside the body, and we have taken to ICU, and the patient has died. We are very sorry. The patient is very upset, doesn't take this death easily. My nice wife, and who I was going to get a gift of a child, normal, how this can happen? He said, I want a post-mortem. And when a patient demands a post-mortem, the doctor and the hospital has to do it. The post-mortem findings was the fractures in the pelvis, fracture in the sacroiliac joint, left sacroiliac joint, the mesentery, transverse colon, all this, plenty of contusion. There is hemorrhage, bleeding in the peritoneal cavity, lot of blood. And therefore, what is all this? So, therefore, he goes to the National Commission. This is what has happened. I think somebody has beaten up my wife in the operation theatre, creating all these injuries. How can so many injuries come? Instead of delivering a child, they've given me a dead body of the wife. The patient, that child is not delivered, and somebody has something has happened, trauma to my wife. Ultimately, after cross-examination, it was discovered the lady had fallen off the table in the labor room operation theatre. For LSCH was taken, she has fallen off the table. So therefore, a huge compensation of 1.6 crore with 7% interest was granted. This was done in May 2023. The safety point is that when you put in the table, etc., please see the person is strapped, stabilized, does not fall off, etc. And this is very, very important, and this is what is happening. And Namita Chatterjee versus Maushami Banerjee National Commission judgment, wherein the patient went for a cataract surgery post-operative. The patient has a white eye, and the patient lost the eye. And then they went to the court, National Commission, saying that he has become blind and any compensation went for just a cataract. when they saw the records of the hospital, there is no cleaning of the operation theatre, no records can be shown. The environmental swabs are all positive, full of bacteria. It is a very unhygienic hospital, not clean at all, full of infection. The biological indicators are not there at all. There is no sterility maintained, and therefore the hospital lost the case. Versus in Air Commodore versus LV Prasad Hospital, wherein a 70-year-old gentleman of diabetes goes for cataract and lands with a post-operative infection, and the endophthalmitis evisceration is done, and the patient loses the eye. But the hospital has maintained all the records, infection control, the cleaning of the theatre every day. They showed that the patients operated before and after this patient had no development of any infection. Then they showed the biological indicators, all the instruments are properly sterilized, linen is properly sterilized, fumigation and other cleaning of the theatres are properly done, the environmental samples, everything proper. The patient was diabetic. When he was discharged, everything was properly done for him. For eye discharge, they referred to a physician who prescribed the proper antibiotics. Maybe at home, senior citizen diabetic, he may not have maintained proper hygiene, and because the hospital maintained the proper records, this case was dismissed. So with respect to infection control, if it is not maintained properly, the safety factor clearly shows that we have to maintain the proper infection controls, not only maintain the infection controls, but also the documents to show the evidence that you have maintained proper infection control. If it is not so, even as per the courts of law, the hospital is negligent, and if it is maintained as per courts of law, the hospital has done their duty, they can be, the case can be dismissed. I come to the end of my lecture, towards the end, and Gauri Gopal Hospital versus Sudhakar. In this particular case, the patient is suffering from the appendicitis. The patient is prescribed the antibiotics, painkiller. The antibiotics given, painkiller. What they prescribed, the nurse thought she has given the painkiller, but accidentally, side by side, she has actually given the pancreum bromide, which is an anesthetic agent. By mistake, she has given, she has not even realized the mistake. The patient, it is night time, everybody goes to sleep. The patient is found dead, and there's a flutter. The relatives are very upset. I bought for appendicectomy. The patient came out of theatre, out of recovery room. In the ward, what happened, what went wrong? The patient is dead. And during the investigation and inquiry, they found out that instead of giving the painkiller analgesic Devon, the nurse had administered the pancreum bromide accidentally. Now, this is a muscle relaxant patient. Everything, respiration stopped, and the patient dies. So, this is a loss for the patient, a relative. They went to the National Commission, and definitely for this, this is lack of care by the hospital, deficiency of care. The care, quality of care is not given, and therefore they got a huge compensation as per safety point. The wrong medication is given. One has to see the medications arranged properly. Right medication has to be given. The checking has to be given. The mode of administration. You have the look-alike, sound-alike drugs, which we have to segregate. The dangerous drugs have to be kept separately. Narcotics have to be kept separately. We have studied that in NABH. So all the and the training has to be done, and the regular medication audit has to be done on the flows. So I discussed about a good number of cases, the judgments, how the court of law favors the safety factors, whether it is medication, whether it is infection, whether it is facility, whether it is biomedical, whether it's identification. Now, medical mishaps do occur like this, blood transfusion reaction, medication, wrong medication, all these things, and I'm sure all of you know this. Anesthesia related, retain equipment, administration of wrong gas, burns, etc. All this I need not repeat. This for the completion. But if a mishap occurs, you have to handle it care, see that you salvage maximum, minimize the loss, do your best to undo the damage. Please continuous monitoring the whole incident. So whatever you can salvage, please salvage. Document everything. Be transparent with the patient. Say whatever has happened. Be very calm, be very cool, keep a cool attitude. Inform the patient, because if there is a mob violence, you can be protected. In case the patient is dead, even that you can give for the post-mortem. And never show off the patient in ICU and in OT, etc. I'm doing this masala. They'll find out some fault. And call for the legal help, call for insurance help, and never give compensation. You may condone the fees, but don't say I'm guilty, I'm giving compensation, etc. and behave with a lot of courtesy. I wanted to have one slide on the compensation. Right now the compensation given is enormous. Initially people used to give a case of 4 to 5 lakhs, 40 to 50,000. and 4 to 5 lakhs was a good sum. This was about 10 to 15 years back. Now this case, Krishna Kumar was the state of Tamil Nadu, baby Sharanya who was 7 months old with the retinopathy of prematurity. This was failed to be detected when she was born. She was a preterm baby and they had failed to detect it and ultimately landed in stage 5 and nothing further could be done. And then the father took to National Commission. They had given 36 lakhs. Further went to Supreme Court. The Supreme Court had a different method of compensation. The two principles which they follow is future value is equal to present value into 1 plus R raised to N. This is similar to motor accident tribunals where R is equal to the age of the patient and N is the inflation factor. So because of this inflation factor and age, now the baby Sharanya was 7 months, so she would have lived at least up to 55 and 60. So compensation has to, the inflation factor comes and the length of the life comes. So depending upon the age, the younger the person, the more the compensation, and you take the inflation. A person who's 70-year-old may get less compensation, a person who's 20 will get more, and inflation taken into account. The other factor which they take is restitutio integrum, which means how much the patient would have earned had this incident did not occur. A 25-year-old person suffering, say, paraplegia or whatever it is, if he was normal till the age of 55 or 60, how much money he would have earned? So taking all these factors into consideration, the Supreme Court has revised the method of compensation. Also, as we see, Kunal Saha set history in 2011 when they got 11 crores. So after that, what is happening, which was initially 40-50,000 of compensation with 4 to 5 lakhs, occasionally, now every case easily gets about 50 lakhs to 70 lakhs, 80 lakhs easily. And quite often, now the days are come when people are getting 2 crores or 3 crores also. Now also we can say now even the lodging of the complaint is as per the money that is given in the time of registering the complaint. So up to 10 crores you can lodge in your own district forum, which means the compensation they can ask even any amount in 20 crores or 30 crores, but you can claim that compensation if you have taken the service within 50 lakhs in your own local court and the opposite party has to come there. So now compensation is going high. Consultants and doctors are requested to take minimum 50 lakhs or 1 crore or even 2 crore as indemnity, and the compensations are going very high. So today what we are learning is today the conference of safety, that please exercise your safety in all your methods. I'm sure the hospital takes tremendous pain to tell you about identification, medication, infection, facility, and so many other areas of safety. Safety is not just for NABH. It is a big legal importance. Supreme Court upholds that the safety lies, the exercise of safety with the hospital and also through the agents. The agents are the doctors, the nurses, and other staff. So this is what the message I want to convey to you, that up to Supreme Court, that lack of safety is not an NABH, and your quality people will come and tell you, oh, this is not right. Supreme Court will grant compensation, and if it is criminal, it can even be leading to arrest. I'm not here to frighten you, but I'm here just to caution you what can happen if you do not maintain the safety factors. Thank you very much for a patient hearing, and having hope that I've done reasonable justice to the topic given by the wonderful Alshifa KIMS Hospital, by Mr. Priyan, Dr. Khalil, Swati, and Dr. Unil. I leave the forum if there is some time for a few questions. If Swati, if you can kindly permit, or I leave it to you how to manage it further. Thank you so much.
Yeah, good evening, madam. Thank you so much. This is Priyan here.
Yes, thank you.
Yes, madam. See, from morning we were going through various standards from QAI, NABH, and JCI, all these things. But the madam's topic is what it is interesting is the non-compliances of all these standards, what it leads, and how being a CEO or the healthcare professionals or being a doctor, how it is implemented or consequence coming out. That is what. So always madam sections were very much interesting, and we were after post lunch. This is the best section to have on. Over to the audience for any questions. Anyone?
I hope the lunch was not so much of paisam that people have gone to sleep.
No, we had
kept them awake.
paisam also were there, madam. Yeah, we have our BK Rana sir here. Just over to him for a few words too.
Yes.
Thank you, madam.
Good afternoon, Doctor. So wonderful to see you there.
Thank you. Same here, madam. Thank you. Wonderful listening to you as always, giving examples and it's actually about informing people, not about the compensation, but about the threat patient feel, and and how this can be taken by the hospital in the best manner. So thank you, thank you so much for your deliberation. Thank you.
I really wish I was there in person and taken a day off and met all of you. Miss all of you, really.
Yeah. Any questions over to the audience? Legal side, I think they are worried to ask even a question. So,
they can
so
definitely
we'll
ask
give to Dr.
answer
Khalil.
all of them.
Dr. Khalil is here. I will give.
Good afternoon, ma'am. Khalil here.
Good afternoon, Dr. Khalil. How are you?
Very fine. Thank you, ma'am.
Yes.
Yeah. We have a different situation very recently. Like a lot of people are drug addicts coming for surgeries.
Okay.
So what really happens is that when we give anesthesia, they are going to have a total different type of complication which we can't even expect.
Yes.
So that is what we are concerned is about the consent. How we can take that consent, because this whether we can relieve the information to their parents, or we need to take another consent also, because that is a big concern now. Very recently, nearby hospitals and our hospitals have a very big issues on that type of patients. This type of patients are not even getting like in between admission itself, they run off from the hospital. We never know their history before. So how to manage this type of patient, how to take consent of this type of patient, whether we can talk to their relatives about this people, because we used to take history about that, and how to go about it.
Yes. I fully understand, because from your side, you're worried about the confidentiality part, because confidentiality as a Supreme Court, without the consent of the patient, cannot be leaked to anybody, including the parents or the spouse or the children or anybody. Without his consent, you cannot leak out the condition of the patient.
Yes.
So now next we come to is the capacity to consent as per the Contract Act. Now, is the patient who is a drug addict, is he fit to enter into a contract? Now, if he is fit to enter into a contract, number one. And number two, does he have lucid intervals? Would he sometimes become psychotic, sometimes become, be normal? Is there a type of a behavior where at times he is not normal and at times he is normal? So this is very, very important. So if you feel the patient is at times behaving normal when he's signing consent, but other times he could have the lucid interval and then go into some other phase, then at that time, and you want to communicate something, you have every right to give it to keep his next kin who is informed about the thing, because the law permits you that if the patient's condition is not that of a capacity to the contract, and also they have lucid intervals, or drug addicts. Now, when they're going to take the drugs, they are not going to be in normal mentally composed, right? Compos mentis is not going to be there when they are really under the effect of neurotic, psychotic, or whatever it is, over drugging and all. In that case, the law gives you a clause, a leverage, that the next of kin, however, should also be an adult, should be mentally sound, conscious, etc. So there you are permitted. Also, if they are in nervous shock or emotionally in shock or emotionally disturbed, not in a condition to be told, in that case, you have the full leverage. Law gives you the permission to inform the next. Also, if the patient is alone, sometimes if drug addicts are thrown out of their houses. Nobody wants such people in their houses. They are on the road. Then in that case, what to do? The answer is inform the police. The police is a natural guardian for all these type of people. So, yes.
Yeah,
so,
thank you, ma'am.
Yes. No issue. So that is the thing. And even in a consent, you can definitely say a clause that I have been under drug addict for so long. You can make a special consent form for drug addicts. A line stating that I was taking so-and-so drug, so-and-so this. So there will be more drug reactions, drug interreactions, and the anesthesiologist may be permitted to do additional procedure or administer extra drugs as per his judgment and the present this thing without prior intimation, because for everything you have to take consent. So that extra clause, if you add, and we can modify the consent form, that is also an added precaution. Yes.
Yes, madam. But in such case, if that, lots of synthetic new drugs are there, as you know, and the patients, we may not even understand that the patient
can't
is
hear
used
it.
to this.
Can't hear. Tell me, sir.
Yes, madam. See, nowadays lots of new synthetic drugs are there in the market.
Somewhere the voice is going.
Can you hear me?
Part and not hearing part.
Can you hear now?
Now I can hear. You were saying synthetic new?
Yeah, lots of synthetic drugs are there nowadays. And see, these youngsters, they were using it, and when it is coming to an accident and all, they may come to our hospital. And see, emergency situations, we may have to take it for the surgeries or other things. So such cases also, see, unlikely drug reactions are also...
Inform the police.
Inform the police.
That is a safety precaution.
Yeah, that is what we want
police
to.
And the guardian, because they are not in compos mentis.
But
the law gives you a safeguard.
The issue is like they never come out that telling that they do this type of drugs, something like that. Finally, when they are in the OT, we are in trouble. We see
how
a
much
lot
of toxic screen can you keep doing?
Well,
it involves a lot of money. It involves a lot of money.
Yeah, and we never know, because this type of synthetic drugs, we never know in their face. If an alcoholic, we can understand. If another
but that is what ultimately they say anesthesiologist is like a pilot. You have to be constantly in the watchful mode. So I know the anesthesiologist's job is becoming more and more trickier these days. But the need of that is that, when they notice something,
very difficult to take a history itself from this type of people.
Difficult, yes. Where there is a doubt, refuse the patient, let them go to some other hospital. Better to lose one patient rather than take additional risk. So calculate the risk and then decide whether you want to take up the patient or no. I think refusing a couple of patients doesn't harm the corpus so much, but taking in a risk and then landing into a bad publicity for all the good damages, all the good work. So we have to be little, have a little strict watch on type of patients whom we enroll.
Thank you so much, madam. There is no more questions. Over to the anchor.
Thank you.
Yeah,
thank you so much.
Ladies and gentlemen, let's extend our heartfelt appreciation to Dr. Suganthi Iyer for her exceptional session. Her in-depth exploration of the legal and medical aspects of healthcare has undoubtedly enriched our understanding of patient safety. Thank you, ma'am.
Thank you. Okay, then should I quit? I'll do that. Okay, thank you.